morning, everybody. My name is Laura Sipes. I am a volunteer with the Blue Springs Chamber. I also am an independent HR consultant here in the Blue Springs area, and I help volunteer with these Power Hour sessions. This morning we have Dr. Randall Williams, the Director of Missouri Department of Health and Senior Services. The session today will focus on the COVID-19 vaccine distribution and vaccine benefits. Dr. Williams was appointed as the cabinet director and subsequently unanimously confirmed by the Missouri Senate exactly 4 years ago today, March 9th, 2017. Dr. Williams has visited all 115 counties in the state to listen and learn from Missouri citizens. There is a long list of accomplishments on the website. Some of these include creating the first opioid emergency response center in Missouri, increasing the availability of treatment and wraparound services. He coordinated the first Governor's Rural Healthcare Summit. We are happy to have you with us this morning, Dr. Williams. We're ready when you are.
Yeah, thank you so much for having me on. I was in Kansas City this past weekend, helping vaccinate at SWOPE and at the Morning Star Baptist Church. So just passed through there and just very much appreciate the opportunity to be with you. I'll kind of give you an overlay of state of the state. I wake up every morning about 3:30 and read the national and local media and look at reports coming in from us. And we remain second in the country for the fewest number of cases. Only Hawaii's better. So I'll repeat that because you don't read this commonly in the media. We are second lowest number of cases in the United States for the number of cases and have been that way for a month. So that's a testament to the governor's leadership and the work of a whole lot of people, so of which we're very, very thankful. And so at the same time, tremendous emphasis on vaccine rollout. That's why I was in Kansas City this past weekend. We have now vaccinated 1 million people with first doses. And if you combine that with probably 1 million people who've had COVID in Missouri, we're probably up to about 2 million people who are not at risk of getting COVID as they would have been otherwise. We started our first vaccination on December 14th. That was pretty predominantly urban, just because of the nature of the Pfizer vaccine at that time, 94 degrees below zero. But also you have to remember the governor's North Star has always been our most vulnerable. And it's real simple. It's people over 65 and people with comorbidities. I mean, you can just draw a straight line. 70 is worse than 65, 75 is worse than 70. And so one of the second things I look at every morning after I look at our case rate is how many vaccines we've had in people over 85, 60, 75, and 65. And, you know, we're really approaching 50% on 85 and right around 40% on 65 and older. So that's really important to the governor. It's really important to me because we're trying to protect those people who would most likely get really sick if they got COVID. And so we then kind of phased in to a more broader rollout. People quote that our vaccination numbers nationally aren't as high as our case rate, but one of the big reasons for that is very early, we made the decision to send all of our Moderna to our long-term care facilities to a federal program that used CVS and Walgreens to vaccinate all 1,300 nursing homes in Missouri. And that was an all or none. You could only give them one vaccine. You couldn't graduate it. It was you either give us all your vaccine to do what we're going to do or not. And we chose to do that. And they greatly overestimated how many people would need to be vaccinated. They based it on the total bed capacity and not the census and not the number of people willing to take the vaccine. So we've had to claw back that vaccine. But while we, wish it had been more efficient, we certainly don't regret the decision to do that because we thought it was just so vital to vaccinate all our staff and residents in those long-term care facilities. but that program is pretty much wrapping up now. And so now we're sending about 41% of our vaccine to our high throughput centers, 23% to our mass vaccination sites. I was at one with the National Guard in Kansas City at the church on Saturday, and then 8% to our FQHCs and 8% to our to our health departments. And then we've pulled back about 15% to try to fill gaps around the state to arise to things that we see. And so our vaccine distribution plan continues to evolve. It changes. We have a plan, but we adapt it to the situation on the ground. I would tell you that while it's constrained at this moment in time, as you know, we open up tier 3 on Monday, giving local providers 2 weeks to ramp up to do teachers and food industry and defense and national security and those. I actually think defense is not here in phase 2. That you need to be prepared. There's going to be a lot more vaccine in April, like a lot more vaccine. I was on the phone call yesterday with the CDC, and they just think between Moderna, Pfizer, and J&J that they make bold statements like that everybody in the United States who wants a vaccine will have access to it in April, and that we'll have 300 million doses by the end of May from the president himself. So, in a country of 330 million people, you can figure out that's a lot of vaccine. So my message to you as a chamber is that you need to get your ducks in a row, that in April, there are going to be a lot of people getting vaccinated at a lot of places in a lot of ways throughout Missouri and the United States. So this day-to-day, news about, well, the vaccine's here, it's not there. Yes, that's our reality at this moment in time, but that will not be our reality come April 15th from everything our federal partners are telling us. So, whether it's your employees or your group or your organization, whoever, you need to be addressing, as we will be, vaccine hesitancy. We think that'll be much more of an issue in April. Your perception now is everybody wants the vaccine, but in April that won't be the case. So you need to be addressing that. We're going to be addressing that. I would tell you the number one issue there is trust. No matter what group you talk about, rural, urban, Latino, African American, older, younger, whether it's concern about how quickly it came to market, that it's the first kind of messenger RNA vaccine, side effects, risk, safety. At the end of the day, it's always kind of reduced down to trust. Do you trust the person telling you to get the vaccine? I believe, having practiced medicine for 30 years, that the best way to address trust issues is through relationships. That whether it's your pediatrician or your obstetrician or your employer or your clergy, that if you're dealing with trust, you need to find somebody that people trust that delivers the message. So it's probably not as much the message as it is the messenger. So I would share that with you. So if you have a population that you think gets their messages through their clergy, then I think you need to respect that. If you have a population that gets their message through their employer, then I think you need to respect that. If they get it through their provider, their doctor, their nurse practitioner, you need to respect that. So just be thoughtful about that. The CDC yesterday issued new guidance, which we welcomed. People keep saying to me, well, Randall, why should I get vaccinated? It doesn't change anything. Well, now it changes a lot. So there's even more incentive now to get a vaccine because it frees you up to do things that previously you couldn't do, like not be isolated, not be quarantined, and going to places and things like that. So just one more good reason to get vaccinated. We continue to believe that all vaccines are pretty much equal, that the best vaccine Rochelle Walensky, Tony Fauci, Randall Williams, we all say this, is the one that's getting ready to go in your arm is the best vaccine for you. Now, that's not to say when we have 300 million vaccines, if you want to be more granular and break it down, J&J 1 shot versus Moderna 2 shots, 4 weeks versus 3 weeks, I think you might have that luxury then. But right now, I certainly, for any of my loved ones, wouldn't say, well, why don't you wait for this or that? I'd get the one at this moment in time with a limited source that somebody made available to you. We have a great website, moststopscovid.com, that's very clinical. I highly encourage you to go to it. It answers a lot of questions, including the guidance that came out yesterday, which is pretty wonky, to be honest with you. It's kind of, you can do that, but can't do this. And again, I just remind you that guidance is only for people vaccinated. It's not for people who've had COVID. So if you say, well, I've had COVID, I can do X. No, it doesn't apply to that. So we would just remind you of that. And so with that, I'll be glad to stop and answer any questions about anything. But that's kind of the overview of the state of the state at this moment. I just got off, I've had this is my third phone call this morning. I've had a lot of questions about camps and things like those and opening up and when you can expect, and I'm happy to address those through questions.
In the chat, Dr. Williams, we have questions regarding when will hotel motel employees be considered essential?
Yeah, they are in phase 3. So I would think it will be late April.
Late April. Okay. And then also in regards to parents that are in their 80s and they're not yet listed, and the only response that you're getting is that we'll let you know when the vaccine is available for them.
I'm sorry, people who are 80 years old are obviously eligible. You're saying that they try to go get a vaccine and they can't find vaccine? Is that the question?
Correct. This was your question, I believe. Are they not able to get them?
Well, yeah, I mean, at this moment in time, we have 1 million Missourians over 65 and 1 million Missourians who have conditions. So it's 2 million Missourians right now that are eligible. And so right now we've given 1 million vaccine first doses. So we've been really trying to ramp that up in the last 2 weeks before we go into tier 3, which is another 500,000 people. So yes, there would be 80-year-olds in Missouri who want the vaccine, who haven't gotten the vaccine yet, but we are doing everything we can as we get more supply to correct that.
Thank you.
So I have a question. As the chamber, like you said, we have a trusted audience, and what would you say would be the best way to share that message? I mean, you look at the website, there's a lot of frequently asked questions and myth busters and things, but there's almost so much information that it's overwhelming. So how do you pick through and give employers those 2 or 3 bullet points that they really need to share with their employees?
Yeah, I think the first bullet point I would want shared is just that we think it's really important to get vaccinated. And if you don't want to get vaccinated, we at least want you to make a very thoughtful decision on that. So if I was an employer, knowing that I was protecting the health and safety of my employees, and it allowed us as a team or a group to do a lot more things. Now that CDC's put out the guidance yesterday, I would defer to them what they think the best platform or medium is to accomplish that goal. So it might be different for banks, it might be different for teachers, it might be different for industry, it might be different than people on the assembly line. But I would ask everybody's North Star to try to encourage people to get vaccinated. And if not, at least, and we always respect autonomy. I mean, we always respect people who say, I've thought about this, I've looked at it, I just choose not to do that. And we respect that. I practiced for 30 years, and trust me, not all my patients did exactly what I would ask them to do, to say the least. Many times they wouldn't even do what they wanted to do for lots of complex reasons. because behavior is a very complex thing. I would ask them that one of the purposes of this phone call this morning is to give you 2 weeks, 3 weeks to ramp up what that would look like and to let you know that that's coming the second week of April.
So I would say we are absolutely hearing it's not safe and it was developed too quickly. What is the response to that?
Yeah, so I mean that's great because now you have a diagnosis. Why aren't people getting vaccinated? Well, the diagnosis is because we don't think it's safe and it was developed too quickly. So let's address that. I mean, to their first point, 2 of the vaccines are messenger RNA, which have been around for years, but have not been ramped up in millions of doses. It does not affect the DNA. We think it's actually makes more sense that it's intuitively more safer because most vaccines are giving you the virus in some inactivated dead form. This doesn't even do this. This just triggers your body to produce antibodies. So it also had to go through the company's vetting, Pfizer here in Chesterfield, Missouri. Then it had to go before the FDA, which is both external and internal scientists vetting it. Then it had to go through the Advisory Committee on Immunization Practices. Then it had to go through the CDC, and then it had to go through me. And so all of those had to happen before we issued an order that it could be used in Missouri. We've now had a situation in the United States where, and around the world, where the Moderna and Pfizer vaccines have been used in millions and millions of people. And we're just not seeing in these phase 4 studies, we're just not seeing adverse reactions. So, 3 months into this, December, January, and February, we're just not seeing anything that we would worry about. So I don't know. I mean, it's like building a car and people drive it for 6 months and there are no accidents. That'd make you feel pretty good the car was safe. I mean, if you built 50 million cars and after the first 6 months, bad things weren't happening, that'd probably be pretty good, make you feel pretty good. So that's how I would address that.
What other questions do you guys have? Why don't you just jump in since we've got plenty of time?
Laura, I have one. This is Rhonda Dolan. I just want to make sure, Dr. Williams, that I heard correctly, because I thought you said we were opening up tier 3 on Monday, but then I later heard you say a few weeks. So what did I miss there?
Yeah, tier 3 opens on Monday, and that's teachers and a lot of that. It's 500,000 people. It's agriculture. But in April, I'd say around April 15th, I think there's going to be a tremendous amount of vaccine. And I think we will rapidly move into opening up our other phases, phase 2 and phase 3. And so the message I'm imparting to you today is that's all of Missouri. That's 3 million more Missourians that I'd like you to come out of this meeting thinking, if you need to address vaccine hesitancy, if you need to vaccinate, think about how would I vaccinate my employees who are in phase 3, 35-year-olds in good health, that you need to be thinking about that today because it's going to come sooner than you think.
Excellent. Thank you. I just wanted to clarify that. I appreciate it.
I mean, I think some people are going, well, we need to worry about this in June. No.
Right.
I don't believe that's to be true. I mean, if you start thinking, gosh, I have 500 employees who work in an assembly line, I guess we'll have to think about how we'd get them vaccinated in June. I think you need to be thinking about how you're going to get them vaccinated in early May.
Very helpful. Thank you so much. And that's a good problem to have.
It is a great problem to have, which, I'll just segue, gets us into, people always ask me, when will we get back to normal? And I'm asked all the time practically. I mean, people want to know when they can open up, but, right now we're giving guidance to our summer camps that we think they can open up, highly encouraging them to get all their staff vaccinated. They can't vaccinate 12-year-olds, but they can vaccinate all their staff, which we think is how it's largely transmitted. So, that'll be June. Sporting events, you've already heard the Cardinals are coming, the Royals are coming. I think that's going to be happening. Conventions, I think, will be up and going in July, August. I think by August, we'll be opening up schools normally. We'll be opening up universities, all those things, conventions, travel, those kind of things. Now, I don't have enough of a crystal ball to tell you that might not involve some other things, wearing masks, some things like that. Your hand washing, there may be some elements of that, but as far as opening up, I think we'll be there. And I forgot to say on the other phone call, and I'm glad you just asked me that. I talked to the CDC yesterday, and this affects my wife. They recommended that if you're vaccinated, you still undergo employee screening, which I thought was interesting. So like if my wife is supposed to get tested every week at a university, and she's been vaccinated. And so they say those people should still undergo those screenings, which I thought was interesting. So that'd be very pertinent to this audience today. Let's say you're a factory and you've just been doing as your normal operating cadence that you test everybody every 2 weeks. The vaccinated people have to be tested. The CDC says yes. I was a little surprised by that.
Do you understand their reasoning behind that?
No, but they did say that. So, I mean, I guess the obvious answer would be the vaccine's only 95% effective. And so they're just taking in the 1 in 20 who might be susceptible. But it's a little bit at variance with their other recommendations. That is, unless you're symptomatic, you don't have to do these things. So I would think they'd say, if you're not symptomatic, you don't need to be tested. But that's what they said.
Dr. Williams, we have a question in regards to women who are pregnant and or breastfeeding, or breastfeeding. What are your thoughts on getting vaccinations for those groups?
Yeah, thank you for asking that. I'm a board certified obstetrician, practiced for 30 years, and it's been really frustrating. One of the real vaccine hesitant groups that are emerging, I just got off a phone call at 7 o'clock with an infertility doctor who tells me 80% of his patients aren't getting vaccinated. It just broke my heart. Because the American College of OBGYN has clearly recognized that pregnant women are more susceptible to dying and morbidity from COVID. And so certainly I would recommend that women get vaccinated, that women who want to get pregnant get vaccinated, that women who are pregnant get vaccinated, that women who are breastfeeding get vaccinated. However, the official CDC guidance is talk it over with your doctor that's taking care of you individually to see if there are any extenuating circumstances. So I get that, but as a practicing clinician for 30 years, I certainly would have encouraged, and in my own family, it's come up, and they were vaccinated. So certainly practicing what I preach, but there's no doubt that there is this misinformation out there about infertility and pregnancy, which just kind of breaks my heart. It really does. It would sadden me greatly if a patient of mine died from COVID, which happens, because they thought it was going to affect their fertility. How tragic. How tragic.
So I have a question about the county structure, because I'm sure you're aware of the fact that St. Louis County is struggling. And I would tell you directly that we have had challenges here in Jackson County, primarily because we have 3 now different health departments that are all issuing different mandates. And so it's really hard for our business community to follow along with that. And there are some businesses that are doing things right and then some that aren't. But I guess my question is, looking big picture, long term, I know the state's got about 7 bills right now that they're looking at changing that power structure. What are your thoughts? And, hopefully we're towards the end of this, but even with the CDC guidelines, I can't see our county allowing that to happen, not in Independence or downtown KC, but in the rest of Jackson County, we're the tightest in the metro. And so how do we communicate that information back to that county and get things to start opening up like the rest of the state?
Yeah, and I certainly, you can imagine, I appreciate the challenge of it in multi-jurisdictions and Jackson County. I was just there this weekend, and obviously talked to Senator Washington and Quentin and others, fairly frequently. and they've expressed to the governor and me, that it's tough. And so, what I would tell you is this, is that we, at this point in March of right this very moment, while we are second in the country for the fewest number of cases, our message is not saying that to brag. It's saying that to say, Missourians, you need to keep doing what you're doing as far as hand washing, social distancing, wearing a mask, and how you're congregating. So at this moment in time, we really, really want people to be purposeful, that we're with the UK variant. Estimations are that it's 30% of the dominant variant in the United States now. We're seeing it here in Missouri. That we still want to be very cautious. Now, having said that, we are clearly entering an area of transition. There's no doubt about it. I mean, 1 million people vaccinated, 1 million people who've had the disease. And I see it everywhere I go. I mean, it's springtime. The Royals are coming. The Cardinals are coming. The Purple Martins are coming. All sorts of birds are coming. Or the Royals aren't a bird, but the Redbirds are. And so people, with warm weather, 71 degrees days, people are just kind of internally getting this message that, hey, it's, we're there, and we're not there yet. So I just think we're still in this time in which local jurisdictions have to look at all their variables. We try to give them the best data and make their decisions. But I would tell you that I think it's going to get markedly better in April. I really do. I think there'll be great clarity in April, but it's March. So at this very moment, I think you're still going to deal with a variety of jurisdictions saying different things. But I think you'll see more unanimity in April. I really do. And then the broader question, as I tell people, this is the first time in 100 years Americans have seen the authority of public health, either mine or the locals. They've never seen it. We've always had it. Nothing's changed. No new laws were passed. We've been doing this around tuberculosis and other things for 100 years. But for the first time, my ability to shut down things and isolate people and quarantine. I used to make the joke, I don't do it anymore, that I was the only person in Missouri other than law enforcement who could detain you against your will. It was true. Only law enforcement can tell you, no, I'm arresting you. You don't get to go do what you want to do. And that I've always had that authority. So that used to be kind of a joke because I didn't do it. Well, I don't joke about that anymore, obviously, because everybody's seen that authority. And in a democracy, there have been plenty of people who've questioned that authority, going, wait a minute, how does Dr. Williams have the ability to do that? And so in a democracy, you're seeing that debate going on in the legislature right now. And I think that's perfectly reasonable in a democracy for people to debate that. I don't talk about pending legislation while it's in the legislature. I did address this a week ago with them. And I'm sure the governor would say he'll see where they land on different things. But to have the debate about of this, I think is perfectly appropriate.
I have a question about hearing people say that they aren't getting the vaccine because they've heard that the virus is evolving and changing, kind of like there's different strains of the flu. So is the vaccine effective on all strains of COVID, or can you talk about that?
Yeah, so far in the United States, we have the Brazilian, the South African, the UK, which are reportable to the CDC. We've had 2 cases of the UK in patients. We've had no cases of Brazilian or South African. California variant, we've had 3 patients. And then when we look at our sewage wastewater, we see the UK variant and the California variant throughout Missouri, which are more infectious. So the vaccines that we have now, the 3 are all work against all those variants. So we're fortunate at this moment that they work. And you'll hear people talk about that it's really, really important to get everybody vaccinated so that more variants don't come that take a hold in people, excuse me, and spread. So, there's always the worry that a variant will come down the pike that isn't responsive to one of these vaccines. You've already seen that with AstraZeneca in the UK and the South African variant. So if we can get everybody vaccinated so they don't catch COVID in the first place, that'll greatly affect this mutagenicity of the strain of COVID-19, of the variants. But long-winded answer to your question, but yes, the vaccines work against all the variants we have here in the United States.
Thank you.
You're welcome.
And piggybacking on that question, how likely is it that we are going to be dealing with this every year, different strains, just like the flu?
Yeah, I don't know. And people smarter than me don't know. I mean, I hear rumblings that people are talking about a booster shot in the fall. I do hear that from all the manufacturers. So I think that wouldn't shock me if everyone vaccinated has to get another shot in September, October. But other than that, I just don't know whether this was a one-off, it's gone, or is this going to be the new flu of the this century, where every year there's a new strain. I just don't know. I know what I hope. I certainly hope not. I would wish this was like SARS and MERS, which basically just kind of burnt themselves out and went away. We're a one-time kind of thing. That's what I would hope.
So some of our employees are telling me that they've identified about 40% of their population that has not, at least at this point, chosen to get vaccinated. Yeah. So if we say that is true for Missouri, and I honestly don't know what the statistics are for what you're thinking in terms of those that choose not to get vaccinated, is 60% vaccination going to be enough to achieve herd immunity?
It is, yeah. You got to remember, we've already had 1 million people who've had either got COVID or got COVID and don't know they've had it. So you're already talking 1 million there. We got to get to 75%. So, at 1 million, probably 1.2, that's going to be 20%. So if we can get to 55% vaccination rate, we'll hit 75. And we think that's incredibly doable. I mean, all our data shows that 50% of Missourians are going to get the vaccine right off the bat. I mean, they get it tomorrow if we had it. So you really only got to pick up 5% more.
I had another question, which is, we've been told a lot of people have signed up for the vaccine and they're not being contacted for it. So we've been told that people should sign up everywhere and anywhere that they possibly can, and then just take the first available.
Yeah.
I told my grandparents that over the weekends, and they were like, no, we are not doing that. So what are your thoughts on that? Is that a good thing to do, or does that just overload the system?
Well, I mean, I certainly understand it. I mean, especially, at this moment when vaccine is limited. And so, in a perfect world, everybody would go to mostopscovid.com, go up in the right column where it says register now, hit that button, get on Navigator, and that would kind of centrally position you where vaccine was available, and you would go there and register in one site. You've got to remember that before we got to Navigator, kind of the cart got in front of the horse, in which, local entities, BJC, St. Luke's, Research, Truman, were getting vaccine and signing people up. And so we now have the situation in which we know there are duplicate lists out there. I'm sure Jackson County has a list, and Research has a list, and Truman has a list. And now trying to integrate those into Navigator becomes problematic, because we can't just transport them, but we can't take the 45,000 people and move them over. So I don't disagree that at this moment it's challenging. It just is. But I also know that come April, you're going to have lots of ways to get vaccine in April. You're going to be able to go to CVS, Walgreens, Walmart, Health Mart. FQHCs, hospitals, your local provider. We have 900 entities already signed up. That in April for your grandparents, they will have multiple ways. The problem will go away in April. It will. I know that doesn't help them at this moment in time. And I'm not telling them wait till April, but I do know that this is a short-term problem.
Okay, great. Thank you.
And I'm going to speak out of school, but I do want you to know that I called Truman last week and was able to get my daughter an appointment within a couple of days. And I got through on the first try, which was not true at all a few weeks ago.
Yeah.
So I think it's 404 care. Might as well help it out.
Yeah.
Any other questions? Still too early. Nothing? Well, if you do have any follow-up questions, you're welcome to reach out to the chamber. We can get the information back out to everybody. Dr. Williams, thank you so much for joining us today. We really appreciate it. For the next Power Hour session, Tuesday, April the 13th is our next session, and Becca will be presenting Marketing Through the Chamber. It is an 8:30 meeting. If you have any interest in that, make sure you go to the chamber website to sign up. Any parting words, Dr. Williams?
No, again, just thank you. I think looking at the CDC guidance yesterday of the things that it allows you to do, vaccinated versus not vaccinated, as we try to move into opening up more things, which I think is what most people want, would really add that to your messaging of, gosh, this is one more good reason to get the vaccine so you can go see your grandkids. Or, you know, if everybody's vaccinated, you can get together. So, you know, my mother's bridge club at age 91, they're all 4 vaccinated. They can go play bridge now because they're all vaccinated. And so just really would highlight that, that it's something, you know, beyond protecting your health and your loved one's health. It's like, yeah, you can also go do something because you've been vaccinated now. So it certainly highlight that message. And then also just spread the other message that I hope you would take away from this meeting is you really need to get your planning that I think you're going to be vaccinating your employees in mid-April, and that you need to really be thinking what's that going to look like? How are you going to do it? How are you going to address vaccine hesitancy? Who's the best person to speak to your universe about addressing those concerns? To be as leadership, to be leading those efforts right now on March 9th and have a plan clearly in place by April 1st.